Flu season is upon us. With an early start to the usual flu season in California, doctors say now is the time to get your flu shot before you get sick.
Flu season typically picks up right after Christmas, but this year, doctors say we're seeing an earlier start. Dr. Omar Hanafy at Community Pediatric Care Deering says that's exactly why getting your flu shot sooner rather than later is so important.
Basically, just like COVID now and influenza, these are viruses that we are not really ever going to get rid of. They're changing every year to be better at what they do, which is invade our immune system, get us sick, and spread the virus. So when we get the flu shot, we're basically giving our body instructions on how to fight an infection.
Dr. Hanafy says those instructions help your body recognize the virus faster and keep symptoms from getting worse.
Every year we get a new vaccine, and that is giving us updated information on how to fight the flu. A lot of people experience the flu with cough, runny nose, muscle aches, fevers, but there's a lot of complications that can come from influenza and other viruses as well.
And for kids, those complications can be especially serious.
Especially in the pediatric population, this can be things like brain inflammation or even heart inflammation. It can really get even healthy children really sick. So we recommend the flu shot because not only are you going to have milder symptoms, get better faster, you're also less likely to end up in the hospital for whatever reason.
Dr. Hanafy says vaccines don't just reduce symptoms, they help keep families out of the hospital.
Vaccines, in the most simplest terms, are instructions to our immune system on what to do when you become exposed to some bacteria or virus. So let's talk about like a patient who's never been vaccinated. If you've never been vaccinated, like a newborn, you've never been vaccinated, you've never been sick.
There's also good news this year. A new RSV vaccine is reducing hospitalizations in babies.
Babies under 6 months of age are about 2 to 3% likely to go to the hospital. And since we have started giving these vaccines, we've actually seen like 40 to 60% reduction in hospitalizations for these children.
And besides vaccines, steps like washing your hands, wiping down surfaces, and staying home when you're sick help fight the spread. And remember, vaccines are available at doctors' offices, pharmacies, and your local public health department.
A lot of parents are kind of closed off to hearing about vaccines, or they're a bit hesitant and they're kind of unsure if they can or should ask questions. I would say please feel comfortable talking with your pediatricians about what vaccines are due, what concerns we have about those vaccines.